A very warm welcome to one and all, and my heartiest thanks to all for coming at such early morning. But the session in hand is of such importance that I'm sure your hard work and your patience will be rewarded. I welcome on stage Dr. Ashish Gupta to kindly guide us through the Akunah. Thank you.
Thank you for waking up. Uh, can I just get a show of hands as to how many people here are in private practice? And how many of you have changed hospitals in your career so far? Or are planning to change hospitals? Is it confidential? Um, so I'll tell you why I'm saying this, because I firmly believe that us as surgeons, there's two things we do. We go to work every day to help our patients. But the important thing also is we go to work every day to ensure that our practices keep growing and our business keeps growing and we're doing well for our patients. All of us as surgeons, we're all megalomaniacs. We always think that we are better than we are. And unless we actually look at our data and then we look at our complications and we look at our results, we really don't know what is working and what is not working and how we can actually get better. So usually what happens is, I don't know how it is in India, I'm pretty sure it's the same, that all the medical data which we have is either stored by the hospital in an EMR or stored in some kind of practice management software or stored in pencil and paper, or you use some kind of a medical device, your software which is sponsored by a device company, so then you're only taking data off that device company. So I fundamentally think that this whole concept is a bit flawed, because the patient comes to me as a surgeon, and then the patient stays with me, I treat that patient. Fair enough, the transaction happens at the hospital, but I should have the ability to keep that data with me, and if I move hospitals, all those patient data should move with me. It shouldn't be the case that if I've moved from one hospital to the other, then all my patient records and data stays in that hospital, and then if I have to go somewhere else, I have to start my practice from scratch, which happens in many places in the world. So what we did is we wanted to build a company which specializes in personalized healthcare. And originally, and the very important thing with this is evidence-based healthcare. So currently what happens is if you, and I'll show you an thing, that if you PubMed search anything, 90% of the hits in PubMed come from American literature. And that might not be relevant for the Indian population, that might not be relevant for the affordability of your patient, etc., etc. So I think it's very important that in different parts of the world, people develop their own literature and have their own data to support what they're doing. So we started this journey with a mixed reality platform because I wanted to bring mixed reality and preoperative planning to shoulder surgery. So we were one of the first ones to execute an MR platform in shoulder arthroplasty almost 4 or 5 years ago. And then one thing led to the other and led to the other. And what we basically figured out that the data is completely disconnected. And there's an overflow of data. And then the most important commodity for us moving forward is data. Data is going to be money. Data is money. Data is your referrals. Data is your patients. Data is your referral network, your outcomes. Data is a commodity which all of us need to learn how to monetize. And so far, there's no software which allows you to monetize data, and Akunah is an attempt to do that. So this is basically what an EMR is in my head. This is what an EMR is. Guys, can you be quiet, please? Sorry, because I can't hear you and speak. So basically what happens is you put all your data together in an EMR, and the EMR goes, and this is what an EMR looks like. The EMR doesn't tell me as a shoulder surgeon that what's the re-rupture rate of my partial cuff tears compared to complete cuff tears, what's the re-rupture rate of my cuff tears in a smoker versus a non-smoker. The EMR is designed, electronic medical record. An EMR is designed to tell the hospital what their admissions is and is their billing correct or not. And if the kitchen staff is putting the meals in the right proper order, and if the nurses are getting billed and timed appropriately. That's what an EMR is designed for. It's not designed for doctors. So for artificial intelligence to work and for data to work, data needs to be classified, tagged, and categorized. So we need to convert this hump of garbage into something which is classified. And unless you can classify this data in a very short and quick period of time, you can't analyze this. So this was the journey which we started, where I started with Google Forms, paper forms, Excel spreadsheets, Google Docs, hired some Ukrainian developers to build an app for me, etc., etc., etc. And then that journey has taken us over the course of the last 8 years to build a software which is simple so that we as surgeons can use this in public and private practices and take things forward. And basically what Akunah is a data aggregator. We can take data from multiple different sources, and then you can use this data for surgical planning, predictive recommendations, execution, etc., etc. So it's a very big platform, and we do a lot of things in this platform. I'm not going to go through the details of everything because we don't have enough time. But one of the key things which we're launching in India is that we have a preoperative planning software for shoulder arthroplasty. And we are one of the only companies in the world who can subtract out metal. And with this, I fundamentally don't agree in this concept that you need one robot for one joint. I believe that there should be one robot and you should be able to do any joint with that robot. It makes no sense that each hospital needs to buy 5 different robots because they belong to 5 different companies. So my concept with this is the same, that you have one planning software, and navigation is going to come out with mixed reality with this very, very soon. And that planning software you can use to plan any implant you want. Whether you choose to do Nair, or you choose to do Zimmer, or you choose to do Universe, or whatever you want to do, it doesn't matter, because every patient is different, patient's affordability is different, your rep support is different, what you want to do might be quite different. But the software should be one. And the other thing which needs to happen is that your data needs to stay in your hands. So just because you're using somebody's implant, that data should not go to that company without the patient's consent, because that's against GDPR guidelines. So I'll show you the planning software and we can do some cases there. But basically the Akunah platform is like really streamlining healthcare. One of the key things which we've done in this is we've built the data which needs to be collected within 5 to 7 minutes. Because if it's not collected between 5 to 7 minutes, none of us have the time and energy to fill this data out. And the other thing is, you and me as surgeons don't have time to fill this. Because if we rely on us filling this data, it will never happen. So we have to outsource this data collection. And how have I outsourced this data collection is I'll explain that to you in the setting. Now, most data collection softwares in the world sit at 7 to 50% data collection. And why is that? Because the patient doesn't get anything in return. So what I built in Akunah is that I built a medical education platform. So as soon as the data gets collected, the patient gets a video. He has some incentive to put data back in. We've got a PACS platform, etc., etc. There's a whole operative note platform in here. So I'm going to skip through this for the sake of time, and nothing speaks like showing you what it really looks like. So it's a cloud-based software. Okay. You sign in on the cloud-based software. You can sign in anywhere in the world. You will come onto a screen which will be like this, okay? And in here then, this is a demo software because I can't show you my live patients in this setting. So we will just look at a demo account here. So you've got a scheduler, you can schedule your patients. There's a PACS which is built in here. There's an Akunah Med platform which is built in here. There's a data export built in here. But basically what happens is I'm going to click on this. The patient has their own platform. They create the username and password. Once they create their username and password, they become a part of this journey. And then in this journey, all your treatment notes, which is your op notes, all come into here. All your patient documents come into here. So you know how patients carry folders because they've gone to multiple different people for second opinions, third opinions, here, there, everything. All of that just gets scanned. They can take a photo and then they can add it in here. And as soon as the patient shares that with you, they're on your platform. Now, if I look at the prompts for this patient, one of the important things in the platform which I built is that many of us work in more than one hospital. So you can choose different organizations for this patient. Could be hospital 1, hospital 2, hospital 3. You can choose if you're doing knee or shoulder or whatever. It's built for all of orthopedic. So this is showing you knee right now. If you want to look at shoulder, you can see the data collection for the shoulder side of stuff. All of this gets collected within 5 minutes, and we'll show you how that's done. So patient comes to my clinic. We give them an iPad. They sign a username and password, create an Akunah account. In the iPad, they take 5 minutes to answer 15 questions for the shoulder. The knee questionnaire is a little bit longer. They fill out all the data. As soon as they fill this data out, My research assistant, fellows, registrars, residents, whoever they are, examine the patient. When the patient gets examined, this range of motion data comes in. If their strength is measured, automatically I will get a constant score. This whole process, if my fellow or the research assistant doesn't examine the patient, takes 5 minutes. If the fellow or the research assistant examines the patient, it takes around 15 minutes. This is the point of time the patient comes to me in my room. Okay? When the patient comes to me in my room, then I can look at them as to what's happening. I go back, I can see all their past treatment notes. I can see if they've had surgeries done before, whatever they've had done before, you know, everything's here. Their op notes are here, etc., etc. All of that kind of stuff is here. So if you know, if they've had surgery, etc., etc. before, then I would say, okay, you either need surgery or you don't need surgery. If you need surgery, then I'll book them for surgery. If I don't need surgery, you need an injection. If you need an injection, I've tied up all my radiology practices on this platform. I will create a referral here for the radiologist, and this referral will go directly to that radiologist. Now you can have a deal with any radiologist you want, but this way you can ensure that the referral goes to that radiologist and the patient doesn't walk away with it. Okay, so then it closes the loop. Once the imaging is done, the imaging comes back here to the PACS part of the platform, which is here. So you can see all your imaging together. Then you do an operation. Say I'm going to do a rotator cuff repair on this patient. I open this, I say this is a private patient. Okay? Because most important bit in this is that we need to be able to collect the data during surgery. That is very, very important. Because otherwise you cannot differentiate an ACL with a meniscal tear, ACL without a meniscal tear, ACL alone, etc., etc., because all the outcomes are different. So we say outcome for surgery this, and we'll say cuff repair. And then you can choose here, and everything is pre-populated. So if I say rotator cuff repair, or I say instability, or I say arthroplasty, all the classifications are built in here. So all you have to do is tick, 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 to all of these classifications. I've timed it because my attention span is 90 seconds. If it takes me more than 90 seconds to do something, I forget. So I've made it in such a way that it should take less than 90 seconds, and then your data collection is robust. Then you go to continue, and when you go to continue, I will just take all of this out, and I'll say that just maybe it's just a other, and I will just say biceps or something. And then when you come here, it will take you to the operative notes here. Then you can type an operative note here, or if you've got a saved note, you can say, okay, rotator cuff, bladder, bladder, select, and it gets pre-populated here, and then you can submit this and it gets printed. After this note is submitted, you have a choice to choose what proms you want, and you pre-populate all your proms. You want proms done every 3 weeks, 6 months, 1 year, etc., etc. I will say biceps, tendon, shoulder, I will submit this. So then this automatically puts it in the diary of the patient, in the diary of the thing, that these proms have to go to the patient, and they get a highlight as to when this needs to get collected. Now, the power of this starts coming is once you start seeing longitudinally how this data is collected. And once we see longitudinally how this data is collected, you can start seeing these trends, okay, which is really powerful. Patient-reported outcome measures, okay? So then over time, so in my practice, this has given the patients a lot of courage to see that their pain's coming down, because everybody comes back after a rotator cuff repair in 6 weeks and say, Doc Saab, kya kiya? What have you done to me? And here, because the physio is entering the data, they go see a physio. Every time the physio enters the data, or you enter the data, you can see them here. In the meantime, what we've done is we've built a complete medical education channel here. And just this tool has increased my practice by 30%. Because we collect so much of content. We're presenting in this conference today, in Ayyappan's meeting. The whole meeting's gonna come up here. You will have your video which is tagged here, so the muscle advancement techniques here. You can look at it, there's a 1 hour technique there. So the way this works is there's a global public channel for all sorts of videos for the patients. Then there's a global doctor channel only for surgical videos. And then I have my organization public channel, which is for my patients. And in this, I've put all my physiotherapy videos in here. You can create a journal club for your resident or registrar teaching, and all your journal club presentations could be there. I have my post-operative rehab protocols in here. So now the patients know exactly, once they've had the surgery or before they have surgery, what all they need to do. I don't like to call this marketing, but this is a very, very powerful tool in educating your patients and empowering your patients' outcome and your journey. Once they see this, if they're doing the right exercise, they fill out the scores, you get the data back, and then this is an endless loop of referrals because people can see that you're connected with them even after they've left your practice. The other thing which we've built into this is we built telemedicine into this. There was a court case in Sweden where a guy got sued because they put a patient's data on WhatsApp, which ended up on Facebook. I know India runs on WhatsApp, but in the future this violates every principle of data privacy for GDPR. It's like putting your bank account on WhatsApp. None of us would open our bank account and put it on WhatsApp. So Akunah needs to be treated, your patient's data needs to be treated like your bank account. So we built a connect platform in this so that you can text the patient, you can say surgery went well, see you tomorrow. And then immediately you can do this as a video message, you can do this as a text message. Immediately this will go to the patient. And so then the question is, why do we do this? I've been to so many Indian meetings now, and I kid you not, some of the best surgeons of the world are from India. But one of the biggest problems in India is people don't have data. People come up to a meeting and they present their 4 or 5 cases and they say patients are doing really well. No one believes that. You guys are just kidding yourself. No one wants to see how good you are. People want to see what your complications are because that adds trust and credibility. So unless you can stand up on a podium and say, I've done these 100 cases and I've had 20 complications and this is my rate over 2 years, no one's going to believe you and say where the credibility is. So for this, we've built a whole system of data export, which is in Akunah. So you can take your data at any point of time and export it. And Ayyappan, you might be interested in this because I haven't shown this to anyone, is that we're starting a new platform which is called Akunah Insight, which is going to get launched very soon, and it'll be preferentially to people who are on the platform first, which is a complete AI platform. So then you go shoulder, you look at national data, which could be Indian data, or then you look at global data. And I've done some searches on this here, and I've said, let me look at range of motion of patients who had reverse shoulder replacement. I was doing these searches in the morning, and this is your AI platform. It'll show you all your data, what your range of motion is, what your post-op scores is. It'll show you external rotation, internal rotation, and then it searches the whole Australian Joint Registry, gives you all the data from the Australian Joint Registry, and it does a PubMed search on over 2.5 million articles at the same point of time to give you a meta-analysis of all the literature which is there for rotation after shoulder arthroplasty. So this will give you very, very powerful metrics when you're talking to a patient or you're talking to a colleague or you're talking to someone to see how the whole data collection which you have been doing over time will make a difference and power our data. Because as I said before, I didn't realize that the difference in this from the Akunah platform that, fair enough, I have a lot of data and I've collected the data. But when you start doing, so if we look at something else, just look at constant score of patients after rotator cuff repairs. So right now it's just showing my data because I'm the only one on the platform here at an international level. And this is the constant score of all my rotator cuff repairs over time. And then it gives you a complete PubMed search of constant scores on rotator cuff repairs, etc., etc. You could look at a constant score of a rotator cuff repair, 1 centimeter rotator cuff repair. I can look at pain after arthroplasty. There wouldn't be much data on the Australian Joint Registry because we don't collect VAS there, but this shows me my VAS of the last 800-900 arthroplasties which I've done with a complete PubMed list of actually what all is the literature out there which says that. So I have been using this very powerfully in my clinic because one, you can show a patient that, okay, if I've done an arthroplasty, in 3 months, your internal rotation should get better and your forward elevation will improve over time. This coupled with the other metrics which we show the patient here on the dashboard gives the patient a lot of confidence in what we're doing for them during surgery. So being able to see numbers, being able to see stuff in black and white and very clean graphics gives patients a lot of confidence to see what their scores are. In addition to them, we've powered the patients with a medical education platform so that all the videos are there. If someone is stiff, because in Asia and in India, frozen shoulder after cuff repair or frozen shoulder is very common. So all the exercises of frozen shoulder and cuff repairs with frozen shoulder or cuff repairs without frozen shoulder, all of that is differentiated here so that in your journey, for the patient's journey, we're powering them. I have two principles in life. My first principle in life is I don't want a phone call. Every phone call you get from a patient is just a headache. Your BP goes up, your peptic ulcer gets worse, and you can't run a sustainable practice. So the more stuff you can do digitally and empower the patient, the less phone calls you're going to get. If you get less phone calls, I have more time to generate more work. Secondly, I want to train people and educate people, and this is a massive platform for fellow education and training, and as a result of it, all our fellows from 16 countries now are on this platform, and all of us are pooling our data together. And then so the registry which we've built, or a registry here, is getting bigger and bigger in terms of that. So how we've done that is, I'll just show you here, that the patient passport then links to the registry, and sky's the limit. You can look at shoulder arthroplasty outcomes, and one of the work cover, which is the Workers' Compensation Tribunal, wasn't approving shoulder replacements in Australia. I looked at my data, I pulled it out, it took us a day. I went to the work cover compensation board, and you said, actually, if you look at it, the work cover patients and the private patients are doing exactly the same in terms of shoulder arthroplasty. And since then, my approvals for shoulder arthroplasty to the Workers' Compensation Board for massive cuff tears where patients who are older has significantly improved. Same thing you can do for, rotator cuff surgery outcomes, which I've shown you. A lot of softwares will simply show you these dashboards or these analytics, but I truly believe the future, or not the future, the presence of data analysis is with all of this. Now, what we have done in addition to this is we're one of the only softwares where you're not only looking at the data, but for the shoulder part of the thing, we've combined this with preoperative planning. So this is Reflect, which is our preoperative planning software. And I said, we were one of the first preoperative planning softwares in the world to be able to do revisions. It does lattice, it does instability, and we can do failed ORIFs, so you can do trauma, etc., etc. So what happens is, same software, you get your CT scan gets pulled in, you drag and drop the CT scan, this gets segmented, and this is the first view you will get. You say, okay, this model looks pretty good. I'm going to take the stem out, I'm going to take the humerus out, and I'm going to look at this, and this looks okay to me. I'm happy with this segmentation. I'm going to approve this segmentation. Then I can choose one of these multiple options as to what I want to do with this case. So for the sake of ease, we're going to say we're going to do a reverse shoulder replacement here. And as I said again, it's an agnostic software. So I don't care what implant you use, because different implants work for different people, but this is the quality of segmentation you get in a revision setting where there's metal on both sides. Until I was doing this, I was not able to do a single stage revision. So I haven't done a two-stage revision now for shoulder replacement for 6 years. And the reason for that is that you cannot reconstruct something unless you have really good visualization of what it looks like. So then we're going to say, okay, we're going to choose. So now the issue here is this patient has a lot of bone loss, and I don't know where the zero line is, where I have to recreate or create this from. So we brought about this concept, I brought about this concept about the zero line, which is where the normal is. Because unless I know where normal is, I cannot recreate and position my implant in the right place here. So we've got a premorbid scapula, which is automatically calculated by machine learning, which tells you what the bone loss in this patient is. Now, I'm going to put my base plate. I still don't know what the right position for a base plate in a reverse is. The 000 rule does not apply in a reverse shoulder replacement. It applies for a total shoulder. In a big patient, I might do this. In a small patient, I might medialize this a bit more because I'm scared I'm going to stress them out too much, etc., etc. Then you use your glenosphere. You can calculate, you can form, of course your guide wire comes through. You can form a graft. It'll tell you what the graft thickness is and the graft measures are. We've partnered with companies in Australia which can prefabricate this graft for you to save you time intraoperatively, and especially in bigger revision cases, that's really, really beneficial. Then you can choose what glenosphere you want, and then the glenoid's done. I'm rushing through this, but I'm happy to go through this in much more detail if someone wants to during the course of the meeting. Then the other thing I firmly believe in, that you cannot plan the humerus unless you have the epicondyles. So I've had CT scans done for the whole humerus from the first day of my practice. We choose, these are just generic implants, and we have the ability to look at over 900 permutations and combinations of generic implants. And plus we have partnerships with many device companies. So then this shows you what this looks like. One of the very key features in this which we've built is that you can change your transparency here to see what the inner cortex in medullary cavity is like, so that you have a filling ratio of less than 0.5 or less than 0.6. We have similarly a statistical shape model for the humerus, which is very important in fractures, which tells you what's the right height for this to come out in. You can calculate your osteotomy plane, and then moving forward, once you're happy with this, it creates your model. Now, one of the biggest hoaxes in preoperative planning, which is not correct, is this range of motion. So we've published a paper right now, which is published in seminars, which is going to come out, which basically shows that if you use the numbers in a range of motion algorithm, you tend to overlateralize, you tend to overdistalize, which causes acromial fractures, which causes brachial plexus injuries, especially in the Asian population. And this data is completely wrong because it's a static scapular model, and the shoulder joint is a dynamic model. So we have intentionally deactivated all the range of motion numbers which you get here. And I don't recommend anybody to look at this for impingement because that doesn't work. So then what happens is you approve and finalize this. And then once you've approved and finalized this, within the next few months, the execution of this will be through mixed reality. And when you execute this, it gives you a report. This report automatically goes to the patient. This report automatically rocks up here in your Akunah platform in the dashboard of the patient, which is here. It'll be in the documents here for the patient. And then all your scores, the pre-op and post-op scores, get married with your range of motion, your preoperative planning data. So then you have one software where you have pre-op data, intraoperative data, execution, post-operative data, and then you can really look at your analytics that, okay, in a B2 glenoid, if I put my retroversion at 5 degrees, what is my outcome for this patient? Compared to in a B1 glenoid, if I put my retroversion at 15 degrees, what is the outcome for this patient? So all of this really enables us and empowers us to do better, and it helps us to collaborate together. So I think they've given me the buzzer. I'll stop here. I will take questions and answers. One of the key things with this, as I said when I started the talk again, is an average orthopedic surgeon moves their hospital 3 times in a career. And data is money, and it's my data. And if I move my hospital, I don't want my data to get stuck in the last hospital I worked. I want my data to stay with me. So in my recent experience, that's one of the key reasons as well, is just so that if we can move our data and our referral network where we go, we shouldn't just get tied down to the hospital medical record systems and device company medical record systems to control our data. So I'll stop here. Is there any questions? Ayyappan, you've tried the software. Yes. And you're going to start using this. What's your early? I'm biased, but
we were lucky to use your software. It was pretty good, and we didn't have any of the issues because there is a slight learning curve was there because, and your team, Sean and all reached out and helped us with that. So I think it's a pretty good software, and because when we used it, we found it really useful in one of the papers which we made. We did a paper on frozen shoulder, which is getting accepted in JSCS. So it was really useful. But again, the two concerns was one in India. I think Ceronics was partnering with you, will tell us, is the cost. We don't know what the cost is, how this will work out. That really help us, to apply it in our practice. Second is, again, isn't it data sharing? Because I'm not good with IT or how it works. Because earlier we used to have this Arthrex software, which I think it was SOS software. So it was a pretty good software. It was quite comprehensive, and I think I have seen Dr. Petre use it. And so, what is the difference between a SOS
So
software
Arthrex
and
SOS
this one?
has got pulled from all over the
Yes,
world
yes.
because it's not GDPR compliant. So you can't take a patient's data and put it on an American website for a device company without my consent. So say I'm your patient and you're using Silverlock or whatever it's called, and you take my data and it ends up in Portland, and Arthrex analyzes it. So that defeat, it's like someone's taking your money from your credit card and someone's got visibility on it and you've got no idea. So the other thing with this is that SOS was linked to Arthrex. It's only linked to one company. They didn't do arthroplasty. So Akunah is not linked to anybody.
Why? Because people would ask you the same question. Because isn't it the data is going to Akunah?
It is going to
What
Akunah.
is the data security with us?
So we are a HIPAA and GDPR compliant software, and at the end of the day, you have to put your data somewhere, right? All of us in this room use credit cards. We use Visa and MasterCard. But that doesn't matter. Akunah is like Visa or MasterCard. I'm not the State Bank of India or ICICI or JP Morgan or Chase Manhattan or HSBC, okay? My job here is you use Apple, you use Google, we use stuff. You have to use a technology provider which will enable you to do it. My role here is to ensure that the data stays secure, the data stays private, and the data moves around within the boundaries of consent. So as long as a patient doesn't consent it, whether I am here in Akunah tomorrow or not, that doesn't matter. The software is designed in such a way that that data cannot move. Right. It's the same in Visa. Your money cannot move unless you consent it. And similarly for a surgeon, no other surgeon should be able to see your data unless you consent them to do it, which is not the case with many of the other practice management softwares or with, I don't want to talk about competitors and other things, but that is a significant big problem. So we don't use ChatGPT here. Why don't we use ChatGPT? Because I don't know what ChatGPT is going to do with my analytics and where that analytics is going to go. Yeah. Right? So there's all of this stuff about data privacy, which we've worked a lot on, and us as surgeons, we should communicate with this. And I fundamentally believe, I'm a capitalist. I believe, okay, if I have 200 cuff repairs, and if Arthrex has done it or Ceronics has done those 200 cuff repairs, and they want that data, then the patient and I and staff, everybody should get remunerated for it, or there should be a model to show that this works. It cannot be a pro quo pro system unless it's an ethics approved study, etc., etc.
The other thing, as a surgeon, and how maybe when I had discussion with the other surgeons around me, so the thing is like we need to have a subscription for this. So, and we have the subscription only for because I might have subscription for me for a year. And after the year, what happens?
So you have to take, I have to, by GDPR guidelines, my contract is not just with you, it's with the patient as well. Okay. So I have to keep 7 backups of that data for 7 years. So you use my platform for a month and you quit. Whatever data you've collected in that month, I have to keep that data for 7 years.
So I can access it anytime?
You can't access it once you leave the platform. You export all your data once you leave the platform.
Okay.
So that's why the data export feature is built there. Understood. You will export all of your data and you leave. Right. And I would recommend everybody to export all the data when they leave, and we will ask you to export all of your data when you leave. Sure. But then your organization will disappear from the account. Yeah. But those patients still have an Akunah username and password because they've chosen to be on Akunah. Right. So then I have a contractual agreement with those patients, because why this might happen is I might be a patient, I might come and see you, I don't like you. I go and see somebody else. You've left Akunah. Suddenly you delete my account, but I'm seeing Deepthi Nandan. So I'm still a part of the journey, right?
Yeah.
So you control your part of the cloud and your
Patient-
part of the
patient has-
organization, and then the patient has control over their part of the journey. That's how this is this has been developed.
Right. I also understand that the patient, we can decide how much data the patient sees.
Yes, that's completely up to you.
Yeah. And the last question was on the patient, the planning software. So it is, the way I understand this, we can use it on any of the implants. And you have multiple implants, all the implants are already rolled up.
I will not say all, because the implant companies have to give me the CAD.
Okay.
Now, if Stryker doesn't give me their CADs, which I doubt they will,
Yeah.
because of the competitive pressure with some of the other planning softwares, then I can't get Stryker CADs. But I've got Zimmer CADs. I'm talking to Evolutus. I've got, I've got CADs for Medacta. I've got CADs for Exactech. So that is a B2B relationship which we have with companies based on the demand of the surgeon.
Sure.
But at the end of the day, a 25 circular base plate is a 25 circular base plate. It still helps you and enables you to do stuff better. Then fair enough, it's not one competitor's base plate versus the other.
Right. Thank you. If no further questions, we'll go to the felicitation ceremony, because we have Dr. Andy V and Dr. Philip also here. They'll be leaving for the Cadaba soon. So we'll have a small felicitation for Ashish, Philip and Andy.
Ashish, you didn't give a straight answer to the subscription.
Say that again.
You didn't give a straight answer to the
No,
subscription
no, I'll give you a straight
question.
answer to the subscription. So the subscription model is based on the volume of patients you use. And there is different tiers of what the subscription model is based on how busy your practice is. So there's not a one size fits all, because you might see 200 patients or you might see 2,000 patients. And the subscription model is based differently on that. The way I've run Akunah in my practices, I've increased my consulting fee by $5 in Australia. Okay, by increasing my consulting fee by $5. So number one principle of Akunah is it should not cost the surgeon $1. Okay, we have to generate revenue from this. So by increasing my consulting fee by $5, I have been able to pay the license because I use it as a user. I have been able to hire a research assistant, and I'm $3,000 positive each year. So you can build it in any model. You could use it. Some people only want to use it for research. Some people only want to use it for operative patients. Some people want to use it for all their patients. So that's why we have a whole team of Psionics here who will help you in figuring out what your practice is like and how you want to titrate that subscription. So there's no one size fits all, because all of us have very different practices.